You went through your observations, your study over the past years, your experiences. So, are there any ingredients very potent in Shivambu?
Yes, there are some really potentially powerful ingredients. They may be in very minute quantities, but they are instrumental in making a massive change to the body. I do not know whether the dosage of those ingredients is enough to make an instant change, but over time they do make a change. And I'm going to make reference to some of these. We know that body produces these chemicals and urine excretes it as we have understood. By drinking Shivambu, you replenish it. Now we have mentioned earlier, urine is a filtrate of blood and the ingredients in urine are the same that are in the blood. So when you consume Shivambu, you are actually putting back into your system the ingredients that were lost through the blood overnight. Body obtains these ready-made products and does not need to generate as much of the stuff anymore. What do I mean by that? To give an example, suppose I ate a lot of salt yesterday and my Shivambu in the morning has more sodium. When I replenish it, my body is getting sodium in its elemental form. Now if my body needs 25 units and I supply 10 units by drinking Shivambu, instead of making 20 units, they are going to make only the balance. So for example, in other items, if 10 units are required and 5 are ingested by Shivambu, the body only requires 5 more. So body gets a break. It doesn't have to go through the process of generating that much work. This of course assists the body across the whole spectrum of such complementary action. Now I have given an example of only one ingredient. But you can go through the list of items and see sodium, potassium, phosphorus, ammonia, creatinine, the whole works, and the body doesn't need to generate that much since it is getting into ready-made. Now I'm going to talk about some specific known items which have got fantastic action, effective action and known action as far as Western medicine also goes on the body. And I'm talking about beneficial action. So urokinase is one of the ingredients which is found in urine. It is also known that urokinase, when it goes back into the bloodstream, has an ability to dissolve blood clots. Embolism today, if I have an embolytic stroke and I rush to hospital, one of the treatments they give me is streptokinase or its derivatives to dissolve the clot. I don't know how many of you are aware, but streptokinase initially was created because they identified urokinase which dissolves clots. So as a synthetic compound, they created streptokinase and started using it. We also know that natural is always better than synthetic because the body absorbs natural items better. Now there is some compound which is similar to nitroglycerin, I don't have the exact name. Urine contains an artery dilating agent similar to nitroglycerin, which has an ability to increase the coronary blood flow to the cardiac muscle used to relieve angina. This is known, nitroglycerin is a known treatment for treating angina in an emergency. What we recommend in dire circumstances, if nothing is available, you are out in the jungle, I am with Kapil and we are only 2 of us and I get a massive heart attack, the quickest and safest thing that can be trialed, since you don't have any other option, is if I pass urine to collect it and get me to drink it, or collect it and rub it on my heart chest area, because if there is any nitroglycerin element through type quality in that urine, it is likely to give some benefit. Now, anti-neoplasm. Now, anti-neoplasm is anti-cancer. A lot of work on this has been done by Dr. Stanislaw William Buzinski. He is based in Texas. He isolated this peptide fraction from human urine, which has been found to selectively stop the growth of cancerous cells without significantly affecting the growth of regular cells. The work he did was somewhere in the early 70s and 80s, and and he started helping patients with cancer and treating them successfully. Unfortunately, the American FDA banned it because it was urine product, and they said it can't be done. Given it's not advisable, and if he has to do something, he has to synthesize it, and only then it can be used, because then it becomes a drug. He worked tirelessly for another 10 to 15 years and then synthesized them and used them for treating cancer patients, knowing fully well that natural is superior to synthetic. But his hands were tied. Today he practices in Texas, where he has always been. But the drug lobby, they are still against him, as he is practicing generic medicine which cannot be patented. And this is a big loss for big pharma.
Okay.
Now some more ingredients that are quite useful. H2, a substance in urine that inhibits the growth of cancer cells and decreases already existing cancerous tumors without interfering with the repair process. Uric acid. This part of urine helps to control the process of free radical scavengers or cancer-causing molecules in the body, controls the aging process, and covers tuberculostatic effects. Beta-indo-acetic acid is an inhibitor of somatic growth in animals and of carcinoma and sarcoma in animals. Retin from urine showed an inhibitory action on the growth of transplanted malignant tumors in mice. This is all formal research that has been done and acknowledged. Directin, when added to the culture medium, causes all cancer cells on which it has been so far tested to align themselves end to end into straight rows, which makes it difficult for them to propagate. 3-methyl-glyoxal. This was isolated by the Nobel laureate Albert Szent-Györgyi, and he observed that this substance has been shown to destroy cancer cells. Now you would have noticed I've listed about 6 or 7 so far which have got anti-neoplasmic activity. So there is immense benefit in the ingredients of urine, which we refer to as Shivambu. Going on along further, allantoin is a nitrogenous crystalline substance and oxidation product of uric acid, that is purine metabolism. This is used in medical and veterinary professions to treat wounds and to stimulate growth of healthy tissue. Protein globulins, having antibodies to specific allergens found to be identical to the proteins in serum or blood, or immunoglobulins. Renin, produced by the kidneys, maintaining the body's vascular tone and thereby influence blood pressure. It is used by the body to regulate the production and liberation of aldosterone. Creatinine and hippuric acid have been known for their antibacterial and hence anti-tuberculostatic properties. Creatinine is a product of creatine metabolism. DHEA is a steroid secreted by the adrenal gland and excreted in large amounts in the urine of males. Now, most of you, if you are not aware, hormones do not actually change within the body. Hormones are catalysts to stimulate the body functions to occur. So generally most of the hormones that are secreted, utilized, trigger the body to work, and then they get excreted in urine. This component, DHEA component, prevents obesity, extends lifespan of animals, and is a possible treatment for aplastic anemia, diabetes, and breast cancer in women. Now, just because I am making these claims does not mean I want people to go away from their existing treatment and run out and start taking Shivambu and stop other treatments. But the point I am making is these ingredients have got beneficial activity towards some of these conditions. DHEA stimulates bone marrow and increases production of all bone marrow elements, including red cells, platelets, monocytes, macrophages, and lymphocytes. And lower the levels of DHEA seem to be related to the aging process. So DHEA has got some anti-aging property, and it takes care a lot about our blood ingredients. Adenylyl cyclase produced by the kidneys is a hormone which produces a chemical called cyclic AMP. This chemical is the mediator of actions of all hormones in the body. So this is like the master one which controls a lot of other hormones. I know this list is getting longer, but I do want you all to understand the importance of the ingredients of Shivambu and how they have a magical effect. Urea is an end product of protein metabolism, renders antibacterial property to urine. Due to its antibacterial nature, urine has a strong inhibitory effect on the growth of the tubercle bacilli. The urea level found in the kidney exercises a marked inhibitory effect on inflammation. Bacteriostatic and bactericidal effects of urine increases with decreasing pH. Urea is an organic solvent, dissolving fats and other natural body secretions. Urine peptide or polypeptide is found in urine having tuberculostatic activity, which has been isolated. Its molecular weight is said to be very low. Opsonins is a blood substance which acts on the bacteria, causing or leading them to be more easily destroyed by the phagocytic cells, which means it makes it easier for the body to overcome that infection. Growth substances are considered the plant hormones or auxins found in urine. The effect of these auxins is to stretch the cell, not multiplication of the cell. The list is getting longer, so obviously there are lots of magical ingredients. Erythropoietin, a hormone which stimulates the bone marrow to produce red blood cells. Many sufferers of anemia who practiced autourine therapy have improved their condition. Hormone erythropoietica has been found to stimulate the formation of red cells in the body. Prostaglandium is a fatty acid derivative produced by various organs of the body, including the kidneys and prostate glands. This is good for hypertension and can act as a birth control agent. Ferments. A ferment of anti-anemic properties was found in the urine of patients suffering from pernicious anemia. Autourine treatment improved the blood picture, increased the reticulocytes, and had a favorable effect on the general condition in anemias. Then there are various enzymes like we know about pepsin, trypsin, amylase, lipase, and maltase. These are also present in normal urine. Agglutinins and precipitins have neutralizing activity against polio and other viruses. Oxyprotic acid compounds, a well-characterized group of peptides, has been found in human urine. Proteose is found in urine of allergic patients. It was felt that this contains a specific antigen to which patient was sensitive. It was demonstrated that it could be employed for specific desensitization in measured doses in many types of allergic conditions. And it was used for the treatment and cure of urticaria, prurigo, dermatitis herpetiformis, psoriasis, eczema, asthma, rheumatoid arthritis, and also hay fever. Urine injections have been used, which was effective in water retention, in spasm of larynx, pertussis, tinnitus, skin conditions, spastic paralysis, migraine, asthma, prurigo, eczema, hay fever, etc. Application of urine was also observed to improve the blood pressure of patients suffering from pernicious anemia. It has been observed that the body will produce the very enzymes needed to heal the body in disease conditions, and these particular enzymes are found abundant in urine. The above properties of urine, which I have listed and described, have great therapeutic value, including the power of destroying bacteria, and this goes in the line of practice of allopathic or Western medical practice. We are aware that the pharma industry collects urine of normal people and pregnant women. This is to extract elements from urine for fertility drugs, cosmetic creams, medications, etc. that help rejuvenation of the skin, body, and creating effective medicine.
Okay, so this is a very long list of
It was a long list.
yes ingredients from, and that is all from the allopathic and modern medical sciences.
Correct.
Yes.
So there's no reason for allopaths not to accept that it is effective.
Yeah. So, is there any reference that our Ayurveda or ancient wisdom references for Shivambu?
Yes, there definitely is. Now, the main reference that we have, which as part of the series we are going to talk about, is Shivambu Kalpavidhi, which is a chapter in the Dhammatantra. It has got 107 shlokas. Okay. But there are other regular Ayurvedic texts which make reference to Shivambu in some small way. So, for example, Yoga Ratnakara talks about Shivambu has an effect which controls the increased bile, or in Ayurvedic terms, pitta, destroys or cleans the intestine, calms the nerves, destroys laziness, and is an antidote to poison.
Wow.
Now, we do know that there is reference that long-term practitioners of Shivambu may be protected against poison.
Right.
Even Ayurveda here, Yoga Ratnakar makes a brief reference to that. Bhava Prakash talks about it destroys poison, if properly used, gives new life, purifies blood, cleans the bowels. Harit talks about destroys cough and cold, improves digestion, makes the body strong, and destroys eye diseases. Sushrut makes reference to human urine is an antidote to poison. So poison seems to be a big thing here.
Right.
Of them have mentioned it. There are three more authors which I don't have the names for, but they have said they cure eye diseases, reduce enlarged liver, control skin diseases. It is an antidote to poison and very good tonic or mirgantu. There are a few Ayurvedic medicines made in conjunction with human urine. Now these are very minute references made when we compare it with the Shivambu Kalpavidhi. The Shivambu Kalpavidhi is a real
Text, we can say.
complete text on
Complete
Shivambu,
text.
whereas these have just made all references to the topic.
So, how does you compare these references you have given along with the Kalpavidhi, Shivambu Kalpavidhi?
Okay. Shivambu Kalpavidhi actually talks about details of how to ingest, what materials to use, the times, the effectiveness of that over many years. And we are going to touch on that in another part of this series where we'll talk exclusively about Shivambu Kalpavidhi.
Okay.
The point I want to make here is Shivambu Kalpavidhi is a complete text of Shivambu, whereas all these authorities in Ayurveda have made brief pass along references in a few lines.
Yes, definitely. So, today you have given a very brief idea about the ingredients in Shivambu. You talk about the ingredients of blood, urine, then Shivambu. What is the difference between the urine in body and the Shivambu outside the body? So you have given a scope to the modern educators, modern researchers, laboratories that yeah, there is a big scope. So what is your idea about the research in this field?
Very good question. See, what happens is research in Shivambu has been lacking, and in spite of my work for over 30 years, there are a lot of questions that arise in my mind that we would like more research to be done, and in what aspect and development. So let me list some of the questions I have. So the research questions that I have are, why is urine not effective but Shivambu acts miraculously? Now clinically we know it does that. But what is that missing ingredient? Are we able to measure it? Are we able to quantify it? Are we able to notice in vitro urine and Shivambu measurement to see what is different? That is basic question. What transpires in this conversion process from urine passed from the body to become medicinal miracle Shivambu within minutes? Now it's a same question linked, but it will explain that. We believe it is in contact with air, but what aspect of air we don't know. Is it the oxygen? Is it the nitrogen? Is it the ozone? Is it trace elements of air? So we just don't know. If it does occur, if it is the air contact, how does this occur so quickly within minutes? Because I know when I drink my urine, it's within about 30 seconds, and I take it, collect it from the glass and drink it.
Right.
So within that period, is it possible to have such a big transformation? Because the effect we have therapeutically is immense.
Right.
So when you compare that compared to urine within the body, then I might as well not pass urine and get the benefit. But it doesn't work like that. So what is happening? What is the transition of chemical changes that makes aged Shivambu very effective for external use? Now I haven't talked about aged Shivambu here, but for external use, generally we talk about using aged Shivambu, at least 3 months old or longer. Now I have used 3 months, 1 year, 5 years, 10-year-old Shivambu for different conditions. And there is a phenomenal difference between a 3-month-old age urine to 2 years old to 10 years old. Now I know this might sound like a wine drinker looking at 5-year-old and 10-year-old wine, but truly it is phenomenally different. And for some acute, some severe chronic conditions, especially skin conditions, I've had to use 8 and 10-year-olds with good effect. So how much aging of urine is optimum dosage for various conditions? Now, so far we have been going by clinical basis, but we don't have a measured level. If you take 10 ml or 20 ml will be the optimum dose. So is there some way of looking at 5-year-old you need 20 ml, 10-year-old you need only 7 ml, and that is worth studying. We currently use age urine from 5 to 10 years old for chronic and severe conditions of skin in the body. Now, Shivambu Kalpavidi talks about boiling urine to 1/4 quantity is recommended. Why is it so precise? Why does it say 1/4? So somewhere somebody needs to get into a lab and look at it. We boil it to only half. Is there some missing ingredients? We boil it to 1/3. Is there some missing? We boil it to 1/5. Is it worse? Why have they stopped at 1/4? So these are things that are major questions for me. At this point, I know I've been through a lot of stuff, giving you all heaps and heaps of information, but all I can say is thank you very much. This labor of love and dedication to the lifetime study of Shivambu has shown tremendous benefit to humanity as I have pursued it. I would like to work towards Shivambu becoming the free, effective and most practiced pati in the world. Our hope is for everyone to become free from disease and enjoy good health, happy life and living to the full. I'm going to repeat this. I'm just fussy about it. Our hope is for everyone to become free from disease and enjoy good health, happy life and living to the full. I wish everybody happy, healthy living to all.
Okay. Thank you for such a ocean of information about Shivambu. You have presented a very great information that most of the people from my generation are asking about. What is Shivambu, what are its ingredients, why to take, why not to take. You have enlightened us with the knowledge, and thank you about the last message, that happy health and well living.
Yeah, I hope so.
Yes. Thank you all. Thanks for enjoying.
Thank you very much.